14 new cases of measles in the state since Friday. That brings the total number of cases in South Carolina related to the upstate outbreak to 76, and the total number reported to DPH this year to 79. 8 of the new cases reported exposure at the Way of Truth Church in Inman that was previously identified as a public exposure site. 3 of the new cases were exposed in a school setting, and the other 3 are still under investigation. There are currently 134 people in quarantine and 1 in isolation. And based on the new cases, DPH has identified public exposures at 4 schools and began notifying potentially exposed students, faculty, and staff on Monday. Those schools are Hendricks Elementary, where there are 40 students in quarantine, Marby Middle School, where 13 students are in quarantine, Chapman High School with 5 students in quarantine, and Tiger River Elementary School with 17 students in quarantine. Students from those schools who quarantined successfully without becoming ill are scheduled to be able to return to classes between December 11th and December 15th, depending on the school exposure, unless they are willing and can be vaccinated within 72 hours of exposure, as prompt vaccination after exposure is known to prevent measles infection. All students at previously identified sources of school exposure have returned to school. It's very unfortunate that we're seeing this ballooning of cases now. Although we anticipated a possible increase in cases after Thanksgiving, this is alarming. And we expect that by Friday, we will have even more schools and quarantines to add to the list as our investigations of those potentially exposed continue. Vaccination continues to be the best way to prevent measles and stop this outbreak. And we remind people that vaccines are readily available at many primary care provider offices and pharmacies, as well as DPH health departments. Of our 76 outbreak-related cases, 69 were unvaccinated. Any community partners or organizations in the state interested in scheduling a vaccination event from DPH's mobile unit can request a visit to their location by completing the form that's found on our website. And DPH will prioritize requests for MMR vaccination events if received, and will also take steps to increase appointment availability for MMR vaccination in health department locations, should the demand dictate this. And finally, our measles outbreak webpage has been updated with the annual school immunization data for the first 45 days of the current school year, and can be found on our website. And with that update, Ron, I will turn it back to you. I'm happy to take any questions that folks may have. Thank you.
Thank you, Dr. Bell. And we will now open it up for your questions. If you have a question, please raise your virtual hand and I will call on you in the order in which it is raised. I would ask that you please save any follow-up questions till others have had the opportunity to ask their first questions, and then I'll happily come back to you. Gavin Jackson, go ahead with your question, sir.
Hey, Dr. Bell, good to see you. Just a question about these cases so far, and I don't know how much you guys get into the details here, but any word on complications with these cases? Are they pretty mild? I mean, any word about severity when it comes down to what we've seen so far?
So we track the case occurrence. We do not monitor or follow people through the course of their illness, and I would say that we don't have reports of severe complications. But just from what we know about the behavior of the measles disease, the severity of the course can vary even for people who remain at home and don't require hospitalization. They can be quite ill, and so it can be a range of severity, a range of complications.
Thank you for that question, Gavin. Lauren, go ahead with your question. Lauren, you have a question for her? You may be on mute. Lauren, we aren't able to hear you. If you are asking, you might be able to put a question in the chat. Does anybody else have a question for Dr. Bell? Yeah, Gavin, you have a follow-up?
Yeah, thanks for that first answer. I was just wondering about if you've experienced any issues with people resisting quarantines or isolation orders or anything like that, what that's been like.
We do have concerns about some people breaking quarantine, and that is part of our investigation. We want to make sure that people are fully aware of the risk that they pose to the community if they do not stay in quarantine, as has been reported before. Many of the cases that we have identified, we've been fortunate in that that they developed symptoms while in quarantine. And so for individuals who do not comply with the quarantine recommendations, that is a concern.
Thank you. That Lauren, you want to give it another shot? Lauren, unfortunately, we still can't hear you. Baker, go ahead with your question.
Yeah. First of all, just a quick point. That's Mabry Middle School, not Barbie, in Spartanburg District 1. But anyway, that's just a small thing.
Oh, thank you. You're correcting. If I mispronounce it, thank you for the correction.
Yeah, well, it's M-A-B-R-Y, not M-A-R-B-Y.
Thank you.
Yeah, that's sorry. When you say you're expecting, and you use the word alarmed or alarming, and that you expect more, maybe more cases to be announced Friday, can you expand on that a little bit? I mean, I know you're a scientist, and you work with just the data before you, but that's alarming is an interesting word, and when you feel like you're expecting more news to come at the later in the week, it's I just wonder if there's any way you can elaborate on that at all.
Of course, it has to do with several factors. It has to do with the fact that we have a large number of people who are currently in quarantine. And as I just mentioned, we have seen people incubate out in quarantine. The reason that they're in quarantine to begin with is because they've been exposed to a highly contagious virus. So given the number of people in quarantine, we do expect to see more people there. Because of the high travel days surrounding Thanksgiving, we believe that there are other potential sources that people may have been exposed or may be spreading the disease because of the gatherings and travel of the Thanksgiving holidays. And finally, we unfortunately expect that we may continue to see cases because our vaccination coverage is not as high as we would like it to be. We are not near achieving the 95% coverage for herd immunity, because those are just three of the factors that cause us great concern that we will continue to see more cases.
Thank you, Baker. We do have a question from Carrie Beal in the chat that says, we received a note that one exposure had happened at Fair Forest Middle School. Can you confirm this? I don't believe that was one of the schools that we mentioned.
So the public exposure sites, including the schools, are still under investigation. And as soon as we get the details of those investigations, any new schools that we did not announce today will be announced.
Thank you for that. Lauren, you still have your hand up? We'd love to come to you.
Yes. Hopefully you can hear me. I've had to call in on my phone. Can you hear me now?
We can hear you now.
Okay, I apologize for that. I wanted to ask also about another school. We'd spoken with a parent who received a letter from Dorman Freshman Campus. Can you confirm that someone was exposed there? We were looking at a letter earlier today, and I'm looking at it right now.
So we work to notify the schools and the involved school communities, and we will make a public announcement of any schools where we have identified exposures once we've completed those investigations. And so if a letter has been sent as part of our advance notice, that's not part of our announcement at this time.
And this is Ron Aiken, and I would just add to what Dr. Bell said. There's a notification process that has its own protocol so that the schools are able to notify their communities of students, staff, teachers, parents first, and that's how that should always go. And then after that fact, and after those notifications have been done, then public announcements follow. So that's a protocol that's been in place for a long time for a lot of really important reasons. Gavin, you have a question, sir.
Yeah, Dr. Bell, the SC Religious Freedom Act that was passed in 2022 after the pandemic obviously applies to dealing with religious institutions and organizations when there is a state of emergency declared. Obviously, that's not the case with this situation. But that being said, with that church being essentially the site of all this spreading for the most part, has there been any effort to, I don't know if they still have services or what their relation or situation is right now, but has there been any effort to limit those services or hold off until we get more of an all clear from that church? Or what's the situation been like on the ground with them responding to quarantine?
Well, the church, as well as other facilities that we're working with, have been very cooperative. And I just want to point out that we are not holding facilities responsible with these are the reason that we're seeing these cases where people are making individual choices as to whether or not they're getting vaccinated. So it is cases among people who are unvaccinated largely, and where they congregate or places that they visit may impact those facilities, but it is not within our purview to suspend services or anything of the kind. We are working with the church as well as other facilities and making sure that they're helping us communicate, helping us with our investigations of potential exposures, and that's the extent of our role in public health.
Thanks.
Thank you, Gavin. Do we have any further questions for Dr. Bell? Seeing none at the moment, you can, okay, Baker, go ahead, sir.
You mentioned working with several organizations in this area. Wonder if you could be any more specific on that, or if any of the if Way of Truth has been approached about hosting a mobile visit with the vaccine clinic, or just how any of that's taking shape as far as getting the partners and community leaders you need to help boost that vaccination rate.
Sure. We've communicated with our partners the availability of our mobile services, as well as our health department, our in-clinic services, and the availability of vaccines throughout the community. So it's clear that those resources from DPH or others in terms of getting vaccination rates are available. And I can only comment again that we have had very good cooperation from the facilities that have been impacted by exposures. And we continue to work with them in any way that we can to avoid additional exposures in any facilities. And I hope I've addressed your question. You're asking specifically if the church has requested a mobile unit, and that is available on our website. Should any organization or other like to have us come out, we're happy to do that.
Do y'all request? Sorry to follow up. Do y'all request them to host? In other words, would you ever approach an organization in an affected community or area and say, would you host the clinic?
Well, I would say one approach to doing that was obviously that we scheduled mobile health unit clinics for the course of several weeks. So rather than, as you're asking, going out to organizations and asking them to request, what we did was we scheduled our own clinic times and settings. And now that we are no longer doing that, we are widely publicizing the availability of anybody who would like to have that done to go ahead and request it. And so we feel that that is the best approach if they would like to host a mobile unit, for them to request it rather than us going out to organizations and asking them, will you host?
Thank you, Baker. I think I saw we have a question in the chat from Tom Corwin of the Post-Courier. He asks if the outbreak is still centered on Spartanburg County, or do we have more counties involved?
At this time, all but two, to my knowledge, of the cases are in Spartanburg County. We have not identified any other confirmed measles cases outside of the upstate region.
Thank you for that. Any further questions today for Dr. Bell? Lauren, go ahead with the follow-up.
Yes, hi. Just one more, I promise. I wanted
Sure.
to ask, what has been the financial costs associated with tracking this outbreak? This has been going on for a few months. Have you guys had to bring in any extra people to help with contact tracing? And I also wanted to ask, with the conversation about schools, what's the additional or financial cost to schools and the school districts?
I can't comment on the financial costs for schools or school districts, but what I can comment on is that our teams that are investigating these measles cases are putting in a great deal of hours after work hours, outside of work hours, during holidays, when they are following up. When they're following up on cases. Excuse me. Measles isn't what we classify as an immediately reportable condition, meaning that once a healthcare provider or laboratory identifies a measles case, they must report it to us immediately. And the reason for that is that we respond immediately, no matter what the time frame is. And there is a human resources cost to that, the additional hours that our investigative teams are putting into that work. We haven't attached a financial cost to that at this time. But I will say that it is not just impacting DPH. This is also having, as I said, I can't comment on what its financial impact for the schools, but obviously for the schools, for the families, for people who are in quarantine, who cannot go to work or to school, it's impacting learning. It may be impacting, work. So there are significant consequences beyond the health issues that are impacting all aspects of our communities because of this increasing outbreak.
Thank you for that question, Lauren. Any other questions today for Dr. Bell? Seeing none at this time, should any arise, please send those to media@dph.sc.gov, and we will do our best to answer those questions via our inbox. As always, a recording of this briefing will be uploaded this afternoon to our YouTube page at its conclusion. And I just want to thank everybody for their time today, for their continued participation in this, their patience with us as we continue to investigate this on an ongoing daily basis. It's something that takes a team effort to be able to do, and we require your cooperation and your help, and we appreciate it sincerely. Again, for Dr. Bell, thank you so much for your time today, and I appreciate you all being here, and we will talk to y'all with our next scheduled update on Friday at noon, and next media briefing will be next week. Thank you so much.
Thank you, everyone.